Today I'm going to do assessment on appendicitis. Appendix is a finger-shaped pouch that projects from colon on the right lower side of abdomen. Appendicitis is an infection and inflammation of appendix. This assessment is usually done on the emergency room, doctor's office, or anywhere in the floor if patients show signs and symptoms of appendicitis. Here my boy is acting as a patient and he is helping me on the assessment. So, hello.
Hi.
Are you having any pain?
No.
Any nausea, vomiting?
No.
Any fever?
No.
So if the patient complain of pain, especially on the abdomen, you may want to ask when did the pain starts, how severe is the pain is, what is the quality of the pain, is it radiating or not. You may want to ask, they might show the fever, so you may want to ask if they are having any fever, nausea and vomiting, or loss of appetite. Now I'm going to assess his abdomen. So firstly, the abdomen, I'm going to divide the abdomen into the 4 quadrants. We have to draw the imaginary line from the mid-abdomen, and then like this, and then for other abdominal assessment, we inspect the abdomen, auscultate the abdomen, palpation and percussion. I'm going to auscultate for the bowel sound. His bowel sound is present. If the patient has a constipation, the bowel sound might absent as well. Now I'm just going to palpate the abdomen. Are you having any pain?
No.
So he is already telling no. For appendicitis, I'm going to assess for McBurney sign. For McBurney sign, we have to palpate on a McBurney point. So for that, we have to draw the imaginary line from anterior superior iliac crest to the umbilical, and then from one third from the anterior superior iliac crest towards the umbilical region, we have to press. Any pain?
No.
So if there is tenderness, tenderness in McBurney point is a McBurney sign. If it's appendicitis, patient may complain of pain on the McBurney point. Another we are going to do is Robson sign. So for Robson sign, we have to palpate the left lower quadrant. When we palpate the left lower quadrant, patient complain of pain to the right lower quadrant. So I'm going to palpate here. Are you having any pain?
No.
So if it's appendicitis, patient may complain of pain, and then the Robson sign is positive. The region for both the Robson sign and then the McBurney sign might be the appendicitis, and the cause might be the infection and then the inflammation of the appendicitis due to the bacterial or the blockage in the lining of the appendix. For the further assessment, we have to ask the patient if they have any GI disease, if they are taking any medication for any GI disease like irritable bowel syndrome, constipation. So we have to ask the patient about the past medical history. Do you have any issues related to your stomach?
No.
Do you take any medications?
No.
For further assessment, doctor might order blood test to see if the WBC is high. If there is infection on WBC was so high, and then urine test to confirm the pain might be related to the kidney disease, and then CT, MRI, ultrasound just to confirm the diagnosis of appendicitis. Thank you.